In 2023, this body passed Senate File 315, which expanded accessibility to raw milk. Raw milk is known to be much more likely to include bacteria like E. coli and Listeria that for pregnant women can result in illnesses that compromise the health of the fetus. That, to me, seems much more like an unknown substance than a prescription written by a physician who has no interest in jeopardizing their medical license. And so, Madam President, what I would say when it comes to House File 2788 is that a lot of what we have heard from the senator from Crawford County is simply wrong. This bill does not protect Iowa women at all. It does not improve health care in our state at all. In fact, this is this bill is limiting access to medication that is substantially safer for Iowa women who are pregnant than raw milk. And the fact that the legislature moved this bill through the Appropriations Committee at the 11th hour with no public notice after it clearly failed to meet legislative deadlines is wrong. And the fact that this bill that is attacking women's health care access has been used as leverage to defeat other bills speaks to how broken this system is today. What this bill does, what it actually requires, is that Iowa physicians tell their patients medically inaccurate and politically motivated information. It inserts the Iowa legislature into the exam room. It instructs doctors to push an anti-abortion ideology over their own medical training and judgment. This is government overreach of the most pernicious, dangerous, and personal kind. Let's start with the facts. Mifepristone, which is how it's pronounced, has been approved by the FDA for over 2 decades. The FDA's website states very clearly, question, is it safe to use mifepristone? Answer, yes. Mifepristone is safe when used as indicated and directed and consistent with the Mifepristone Risk Evaluation and Mitigation Strategy Program. The FDA approved Mifeprix more than 20 years ago based on a thorough and comprehensive review of the scientific evidence presented and determined that it was safe and effective for its indicated use. As of 2016, it is approved for use for medical termination of pregnancy up to 70 days of gestation. The FDA's periodic reviews of the post-marketing data and its approved generic have not identified any new safety concerns with the use of mifepristone for medical termination of pregnancy through 70 days of gestation. As with all drugs, the FDA continues to closely monitor the post-marketing safety data on mifepristone for the medical termination of pregnancy. On raw milk, however, the federal government's own food safety website states very clearly that women who are pregnant should avoid raw milk and raw milk products because raw milk, which is milk from any animal that has not been pasteurized to kill harmful bacteria, may contain bacteria such as E. coli, Listeria, Salmonella, or the bacteria that causes tuberculosis. And it is the formal recommendation of the federal government that women who are pregnant should only consume pasteurized milk and milk products, including yogurt and ice cream. The American College of Obstetricians and Gynecologists, which is the nation's premier authority on women's reproductive health, has affirmed the government's view that medication abortion is safe and effective. It has an extraordinary safety record. Studies show it has fewer reported adverse effects than penicillin. And informed consent protections already happen. This bill is not in any way based on medical findings or peer-reviewed science. It is a political statement dressed up in a white coat and forced now into the mouths of Iowa physicians. This is not informed consent. It is politically compelled speech. The American College of Obstetricians and Gynecologists has laid out plainly the trap that this bill, House File 2788, creates. Either comply with the bill and potentially face a malpractice lawsuit for violating informed consent doctrine by sharing medically disputed information, or don't comply and face discipline from the medical board. What the senator from Crawford is doing with this bill is creating a law that puts, if passed, Iowa physicians in legal jeopardy for telling their patients the truth. As my Democratic colleagues have made clear on the floor, Iowa is facing a severe shortage of OBGYNs, dead last in the country per capita, a growing array of maternal health deserts, Birthing units are closing. Many rural counties have no local providers at all. I appreciated Senator Dre observing that the drive on average is 90 minutes and counting. This will make it worse, not better. And the women who were the most harmed by this bill are not wealthy women who can take a day off work and drive to Des Moines or Iowa City. Women who live in Ottumwa or Mason City. Every small town in between where the nearest provider is an hour and a half away or more. Childcare doesn't pay for itself. Not everybody can take off work. Healthcare decisions, including the decision to end a pregnancy, should be guided by medicine and science, not this building. The senator from Crawford said that this bill is about women's safety. And if we want Iowa women to be safe, we could make an actual appropriation to invest in maternal health care. You could invest in expanded postpartum Medicaid coverage. We could invest to recruit providers to rural communities. Invest to address the workforce shortage that is already leaving Iowa families without health care or child care. Madam President, I would urge this body to vote down House File 2788, which is going to further compound the harm that has already been done by this legislature to Iowa's healthcare system and to Iowa women across the state. I urge a no vote. I apologize for rising a second time, but just to be clear, in case this senator from Wapello County, if I misstated my point, we're talking about the health of the mother. And the health of the fetus that is healthy. Yes, it is scientific fact that raw milk is more dangerous to a pregnant woman and her baby than mifepristone is to a woman who potentially, for one of the reasons laid out in the new definition of abortion in this bill, may be ending her pregnancy because the fetus is no longer viable or it is an ectopic pregnancy. That's what we're talking about.